Hi, I'm Perry Atkinson, General Manager here at theDove. Hey, check out our other videos and check out our website at thedove.us. Welcome to Focus Today. I'm your host, Perry Atkinson, and always a delight to have in the studio with us Dr. Joel Klein. He's with Ventana Wellness, and he's kind of like the Shell answer man in medicine.
I don't know about that.
Well, you know, gas and pills kind of go together. Anyway, taking on an incredible topic today, inflammatory and autoimmune disease treatments. Wow. And I made the statement on the air earlier, so correct me if I'm wrong, that one of the major contributors to having problems with sore joints is sugar.
Well, that's, you know, it's what the sugar does.
Okay.
And that's one part of the problem. I mean, the main thing here, we're talking about not, you know, all the different causes of arthritis. And, you know, and as we've talked about over and over how aging is accelerated by inflammation. So all of these chronic conditions of aging are worsened by inflammation, and then we're getting even deeper into regular arthritis, and then the autoimmune diseases are these things like most people will know of rheumatoid arthritis. And then you get into things like lupus or the inflammatory bowel diseases like Crohn's disease and ulcerative colitis. There's, you know, more and more evidence they all have a common root, and they're just affecting different systems. And there are a number of different factors that are going into this, but a huge one does have to do with the changes in our gut that sugar will produce, and also in the environment of our body that promotes inflammation. So that's one part of it. But really, there are a whole bunch of things that have happened technologically over the past 100 years that seem to be all ganging up in the same way in terms of promoting these inflammatory conditions.
Ah, boy, this is loaded. So is autoimmune diseases primarily a result of diet?
That's a good question. Actually, you know, diet clearly plays a part of it. I think diet may be the end point for many, many, many people. The autoimmune diseases have a significant component of these inflammatory type of allergy to food. But where does that inflammatory allergy come from? Well, from the changes in our gut, from our technological diet, from drugs like antibiotics in particular, changes that have happened to the GI tract that then cause problems, and we start reacting to foods that we didn't react before, with gluten being number one on the list for many people. Dairy, corn, and soy also high on the list. It turns out the foods that we're eating most of the time may actually be the culprits, and it's certainly the ones that our government subsidizes, so they're cheap and convenient to be in our food that people are eating all the time, are a lot of times the worst culprits.
Wow. All right, so let me jump ahead and we'll come back.
Right.
We're hearing people say, well, you get lupus, you get some of these other inflammatory diseases. Trying to think of the one where you ache all over.
Well, rheumatoid arthritis.
Yeah, that.
Well, fibromyalgia, that's a little different.
Okay.
A lot of fibromyalgia is actually hormonal. It's not an inflammatory disease because when you biopsy the muscles, there's no inflammation there. Inflammation will produce increased numbers of white blood cells in the area. There are tissue changes that happen with true inflammation that you don't see with fibromyalgia. So fibromyalgia is more often a pain condition, but not necessarily an inflammatory condition.
Okay, so
that's a whole nother topic.
We'll take,
I can do a whole
we should
show
do a
on
show
that.
on fibromyalgia.
Oh, absolutely.
Well, let me ask you this, since we're on it, just quickly. Can you get cured of it? Because
a lot of the times, yes. It turns out, again, just like many medical diagnoses, fibromyalgia is a descriptive term. It's not a real thing that exists in nature. It is something we've given a label to for a pattern. In many people, that pattern can be cured because it turns out there's a hormonal, particularly thyroid and some other things that are causing it. In other people, there are changes in the way the brain conducts pain that have to do. Many people can be better if not cured.
Wow. All right, so back to the autoimmune diseases. Can they be reversed?
In my experience, yes, but it's not easy.
Okay.
I have two main weapons with those. The one is the restrictive diet. Now, the problem is, well, how do I know? The regular kind of food allergy testing will not detect these inflammation type of allergies, and there are a couple of specialized labs in the country that do this. It's very expensive. It can cost $400 to $600 to get those kind of tests. So what we usually do, what I like to call, and many of the viewers will know, what I call the Casablanca approach. From the scene in Casablanca when Louis the police chief says, round up the usual suspects. So we round up the usual suspects of gluten, dairy, corn, and soy. I will put people on a very restrictive diet of like no grains and no dairy in the beginning, and just certain foods that are much less allergenic. That is number one. And then there's this avant-garde treatment that is very effective for a lot of people with autoimmune disease called low-dose naltrexone therapy. Whoa. Naltrexone is a drug that was developed to treat narcotic overdoses. But it turns out that very low doses that a compounding pharmacy makes up, 1/10 of the regular pill dose, but taken once a day at bedtime, has these dramatic effects. It works through endorphins and complex cellular biology, but can have a dramatic effect on people with reversing this autoimmune response. The only side effect can be sleep disturbance. People are taking it at night. Most people will describe very vivid dreams, but they're not disturbing. Some people, it's disturbing enough we have to maybe lower the dose, maybe give it a different time of day, although most of the research done found that it's the nighttime dose, but we can work with that. But I've had some incredible successes. Lady with 20-year history of rheumatoid arthritis who was deformed in the hands, who after putting her on the full dose, low dose naltrexone, this was in Colorado, and then I had to move here, she sent me a card, says I haven't had to take a Tylenol since starting the naltrexone.
Wow.
So not a panacea for everybody, but between the diet and the naltrexone, I can get a lot of people can get significant relief and even come off their some of, if not all of their drugs, but at least some of their drugs.
What are the signs of a, say, an autoimmune disease? We may feel some aches and pains, and we thought, oh, just a normal day. But
those are the more typical ones. Okay. So the ones that cause arthritis we know about that are more lupus, but lupus also causes rashes. But lupus and rheumatoid arthritis, joint pains are going to be the common one. There are other autoimmune conditions. One of the most common definable cause of low thyroid is an autoimmune thyroid inflammation called Hashimoto's thyroiditis, named after the Japanese doctor that described it. Now, what we find when we treat people is a number of those patients, if they don't do anything, the thyroid a lot of times is the first thing that shows up, they will go on in 10, 15, 20 years to develop rheumatoid arthritis. Whoa. Or lupus or those kind of things. Then there are also the inflammatory bowel diseases, which are also autoimmune. And those, again, Crohn's disease, ulcerative colitis. But most of the time we're dealing with inflammatory causes of arthritis. Now, the arthritis most people get is osteoarthritis. That's not necessarily an autoimmune problem because we can't find, autoimmune means we can find antibodies in the blood that the body is producing against its own tissue. You can't find that with osteoarthritis, but it still has an inflammatory component. That's the most common cause, is the osteo. So that's why, but that also can respond to dietary changes.
So where does the testing start, Dr. Klein? Do you start with blood, or do you do thyroid, combination of things?
Well, it depends what somebody's coming in with, obviously. So most of the time, what we're doing, they're coming in with a pain problem. So we're going to do a standard rheumatologic blood work where we, of course, do a blood count. We do inflammation markers called CRP and sedimentation rate, and then look for the more common causes. So there's a rheumatoid factor, which is negative, and now there's a more sophisticated test that has a long name of cyclic citrullonated peptide for rheumatoid, and the ANA test, which looks for antibodies against DNA that a lot of these rheumatologic conditions have in common in different ways, is that we're actually making antibodies against our own genetic material. Now, some people hypothesize it's not, the body's not doing something wrong. The genetic material has been damaged by our diets and toxins and things, so the body's reacting against this damaged genetic material.
Wow. All right, the big question before we take a break, where was this stuff 50 years ago? Is this a result of our lifestyle, our environment?
It was there. We're seeing more of it. And again, how much of all the technological issues of why we see more of these diseases. Some people just say, well, we're living longer. Well, maybe. part of the issue may be both diet, environmental toxins. There's a hygiene hypothesis. We talk about a lot of these issues with our dysfunction of immune system start with the disturbance in our gut, of our relationship with bacteria. And we become, since the 50s, so scared of bugs and germs that we've over-hygienized things. That's why kids love to play in dirt. There seems to be an adaptive response to our relationship with normal bacteria. And when we lose that, our immune system doesn't function properly.
All right, we'll take a break when we come back. I mean, there's so many other areas in this whole discussion, but some people will get diagnosed, say, with lupus or Crohn's disease.
Right.
They own it.
Oh, yeah.
And that's it. I mean, wait a minute. Time out here. Can we get you through this?
It's like many diseases. It's now mine.
Yeah.
Yeah.
Okay.
Common in medicine.
All right. Dr. Joel Klein with Ventana Wellness. By the way, ventanawellness.com is the website. Great resource. We'll take a quick break. We'll be right back. All right, we're back with Dr. Joel Klein from Ventana Wellness. And by the way, ventanawellness.com is the website. It's a great resource, and the clinic is all-encumbering. I mean, you guys provide, I don't know how much you're doing over there now. We're just talking between the breaks here. You're expanding.
Yep. Well, we need more room, so we're moving administration and the dermatology folks over into the Rasa Yoga building next door, so we have more room for more practitioners that we are going to be bringing in.
Well, that's great. We're talking about inflammatory and autoimmune disease treatments, which is a huge topic. And as I said going into the break, Dr. Klein, so often people are diagnosed with, say, Crohn's disease or lupus or something like that, one of those diseases. And it's kind of like, all right, now I got an identity, what I have, and I'm going to change my lifestyle to live with it. Wait a minute, time out.
Well, Yeah, see, the thing is, what people are doing, again, the medical diagnostic system is 200 years old. And the diagnoses, we all of a sudden we take this label and turn it as if it's a real thing. Yeah. It's like some people describe it as eating the menu rather than the meal. So the label is a descriptive term for a particular constellation of symptoms that commonly occur together. Right. That's actually what the word syndrome means. Syndrome is just Greek for occurring together. Okay. So we take these things that commonly occur together and we assume, that's a real thing. Mm-hmm. It's a pattern. And my experience is the pattern has to do with the interaction of that person's genetics with their environment. So you can have different patterns show up with the same underlying cause, whether it's the food issues, the gut, and these kind of things, because I'll deal with all of them basically the same with what I do. Now, medical research is geared towards, well, first you have to have the label, and then we're going to study that label. So you're going to have disease-specific treatments because that is how medical research is oriented. But when we deal with things from a functional standpoint, two people with completely different diagnoses may have the same root cause.
All right. So, the other point I want to make here, all these diseases, when you begin to treat them, there's no cure-all. There's no one pill that takes care of it. You're on a lifestyle change here for the most part. Yeah, well,
like say, if there's one pill, but it's not always a miracle, it's the naltrexone can make a difference. But but my experience is it takes all of these different things because your body is obviously severely reacting to something. Now, can we extinguish that over time? We don't know. We certainly can make it a whole lot better. There are people who have been cured. More often, we get people less dependent on their medications or doing a whole lot better. But I had one lady with ulcerative colitis where 95% of her entire colon was inflamed. And 3 years of doing the diet and the naltrexone, and she's actually out of state. I treated her because her sister was a patient of mine. And she sees a professor of gastroenterology at Northwestern. She's in Chicago. She had her follow-up colonoscopy 3 years later was 100% clean. Wow. No inflammation at all. And even this gastroenterologist was a bit surprised at that because you usually don't see that in people with 95% of their colon inflamed. So it happens. More often, we can help people feel better, be on less medication, certainly functioning better. And a lot of these stronger medicines now have risk of cancer and other things with them. These immune modulating, these disease modulating drugs have a small risk of like lymphoma and cancer. And if we can get people off of those, then I feel we've done them a world of good.
All right, so the alternative therapy that you're talking about comes as a result of an an exhausted examination, obviously, from blood to thyroid and all of those things.
Yeah, we're looking at all the different issues. Hormonal factors will play a role in increased tendency towards inflammation. So I'm really doing a whole look at the person and, quite frankly, the trajectory of their entire life's history. Very commonly, I will find severe trauma, emotional trauma or physical trauma. We'll find frequent infections in childhood that were given lots of antibiotics that messed up the gut. So this has really been a decades-long progression of the person's life that will give me the clues, we need to focus on that, we need to focus on that, we need to focus on that, because the diagnostic testing is not 100%. They even taught me in medical school, God hopes they're still teaching this, that the history is 90% of the diagnosis. If you know the right things to ask for in the history, that will actually tell you what's going on with the person.
Wow. All right, so, but it's not a short treatment. You're in for a while.
No, this is a long haul. Your body is extremely unbalanced, gotten into very deep trouble. Like it's a deep hole that's been dug. It can take months to even see results, and it's usually going to be a long-term treatment.
So what's thyroid have to do with this?
The most common definable cause, most of the time we don't know why the thyroid poops out, but many people we can actually do a blood test and find out they have an autoimmune inflammation of their thyroid. This thing called Hashimoto's thyroiditis. It's a regular antibody test we do with regular labs. And in that case, then I will initiate these autoimmune treatments for these people. I reversed a few people without ever having to put them on thyroid hormone, just treating the autoimmune process.
Wow. And that shows up in a blood test?
Yes, but usually you have to catch it early. If somebody's had it for 10, 15, 20 years, usually enough of the gland has been chewed up, we're not able to reverse it. But if I get somebody pretty early on, I've had a few cases where we've been able to do that.
All right, I have experienced friends who have had lupus and the Crohn's disease. Both are just incredibly
horrible,
debilitating.
Absolutely, people can die from these. Absolutely. I mean, you have a range of people who are mildly affected to people severely debilitated and crippled, and certainly or need extensive bowel surgery. Very, very, very sick. Now, and quite frankly, obviously, the sicker they are, the harder and the longer it takes to kind of reverse that. But we got to start somewhere.
Okay, and a lot of that has to do with what they're eating.
That is one huge part of it. But other things, we have to rehabilitate the gut by restoring a healthy environment with probiotics, with gut healing herbs, sometimes using enzymes, acids, some of these whole things to start restoring the gut, getting the allergenic foods out of the diet. Is the first big step.
All right. You mentioned it, probiotics. Just for a quick question on that. Is that part of what you're dealing with when you're dealing with, say, autoimmune diseases and inflammatory? Is probiotics part of this treatment?
Yes, because much of these issues start with inflammation in the gut that then ripples out through the body. So the first thing you have to do is restore a healthy environment in the gut so that it's not becoming leaky to these proteins in our foods that are setting off the autoimmune reaction.
Now, I've seen anywhere from 5 to 300 billion. What's the deal on that number?
The problem is there's not really good research because usually it's done on proprietary products and things like that. I've heard from 20 to 40 billion. When you're dealing with inflammatory bowel disease, 10 to 20 billion. I have some products that I recommend to people that I've had some good results with over the years, but it's not hard and fast.
Okay.
Yeah, I wish I could say it was, boom, here's what you need to do.
The only reason I bring that question up, because I was standing in the health food store the other day, and somebody was looking at the probiotics.
Yeah.
And it had up to, I think, 40 billion or 50 billion.
Right.
And the mentality was, well, if I get the highest dose, I'll get the quickest results.
More is better, not always, but but yeah, it's for the more severe disease. But sometimes, especially my experience with older patients, is they don't tolerate high doses really well. You can't get somebody who's been 60 years out of balance and try to get them in balance in a month. The body, like, no, I'm adjusting to this. You usually have to go slower with things.
All right. Back to the aches and pains, inflammatory joints and things like that, arthritis. Where do you start with the patient? I would imagine a lot of people listening and say, it's just age, I'm getting older, I'm getting sore.
I said, maybe yes, maybe no. But usually if they're saying that to themselves, they're not seeing me.
Yeah.
So if
or they're not working out.
Unless it's the husband whose wife has made him come in.
Yeah.
But otherwise, no. But it's people, if they're having these kind of things, I'll look at first I want to look at what they're doing now. If they already have a good diet, No, but if the typical and high starch diets and these things will work on shifting that, I'll use some natural anti-inflammatories. The prescription or the pharmaceutical anti-inflammatory drugs as a class were shown in 1999 to kill 16,500 people a year. That's Motrin, that's Aleve, that's all the prescription ones, 16,500 people a year, which in 1999 was as many people as were dying of AIDS. So now it's more people because less people are dying of AIDS.
Why in the world are we prescribing this?
Follow the money.
Okay, all right, follow the money.
Yeah.
All right, so these anti-inflammatory over-the-counter things, be careful.
Be very careful. Tylenol's okay, but you know, when you get, and this whole Tylenol's bad for the liver. Well, if you take a lot of it, yes. But when you get into the Aleves and the ibuprofens and these things, the older people are, the more likely they're going to have gastrointestinal bleeding. I remember when Motrin first came out on the market, and a doctor gave it, so I admitted as an intern, a 95-year-old Italian gentleman, I still remember his name, you know, with his thick Italian accent, you know, that he was vomiting blood from the 600 milligram Motrin prescription. His doctor put him on for his knee pain.
Whoa.
So the older you get, more sensitive. I really want to steer away from those unless they're absolutely necessary. Some people say, I can't sleep, I can't do anything without them. Use the least amount you need to. We use some natural anti-inflammatory things. I have a lot of patients get very good results with to try to minimize the drugs while we work on these longer term issues.
Osteoporosis a part of this?
No, osteoporosis does not cause pain until you get a fracture. Osteoporosis is hormonal and inflammatory.
Really?
Yes.
All right, so are we rushing to get knee replacements and hip replacements?
No, because a good orthopedist will tell you, don't do it now because it's only got a 10 to 15 year life, and then we're going to have to fuse your joint. But are we doing them? I don't know. That's an ethical question. If you do a knee replacement on an 85-year-old? Well, it depends how functional the 85-year-old. Or if it was like my mom until she was 81 and a half, was teaching 10 exercise classes a week, jogging 2 miles in the morning and swimming a quarter mile in the pool in the afternoon. It all depends on, you know, how not chronologically, but how physiologically. But no, usually the good orthopedists, no, you know, really don't do these things until they're absolutely necessary, because no surgery is without its potential complications, especially like a hip replacement, where people can get blood clots and these kind of things. So no, good doctors are making good decisions with that.
All right, let's wrap this up. When somebody comes see you, when are they, if they're beginning to suspect that they may have an inflammatory problem, autoimmune disease problem, when should they come see you?
Well, again, you know, some of it, if they've already been diagnosed with something, then and they're just taking pharmaceuticals, those are people I want to see. When the joint pains are getting to the point where some Tylenol won't help, and we're looking for other answers, those things, certainly if there are more multiple inflammatory issues, a thing that would bring anybody to the doctor says in the past 6 months to a year, you know, it's my elbow, it's my hip, my low back, you know, these types of things. But like I said, typically it can show up as anything, because all these different kind of problems can go into connective tissue issues. But those are usually the time when you start to look for it. If somebody's not severely affected, I'm not going to put them on a severe program.
Yeah. All right, well, there you go. You can get a hold of Dr. Klein at Ventana Wellness, or you can go to ventanawellness.com. That's the website. It's an incredible resource. And if you're suffering in one of these areas, well, you may want to consider an alternative therapy and treatment, at least a balanced one, when we put it that way, because you use a little of both, but you lean more towards...
You know, we try to make the drugs as obsolete as we can, but we use them when we have to.
There you go. Good way to put it. All right, thank you, Dr. Klein.
Okay, thank you as always.
We'll take a quick break. We'll be right back.
Right.